Hi, I'm Sophia, the optometrist who had the patient encounter. I would plan to reach out to my peers with as many details as possible. For example, I would take vitals and document information about the incident so that way there is a clear understanding about the situation for everyone. In addition to that, I would also inform the patient about the other care providers that she would probably want to see about that overdose. And then I would perform pupil testing on the patient as well as doing a retinal image. And then if we have previous records, I would cross-check those and make sure that they appear the same and that there was no major changes in the pupils or in the retinal imaging.
Hello, my name is Roxana and I am the dentist on the team. I would educate my patient about opioids in general. I would let them know the signs of overuse and overdosing of the medication and how to store it so in the future mistakes are less likely to occur. If the patient is experiencing any oral swelling or abscesses inside the mouth that is causing him or her to be using any opioids, the patients are be referred out to me or another dentist, so we are able to address the root cause of the pain and to reduce or remove the use of opioids in general.
Hello, my name is Stephanie and I'm a dentist on the opioid care team. My role is to work with the rest of the healthcare team to keep patients safe while using pain medications. I, along with other dental professionals, will help identify any oral or jaw-related issues that may contribute to pain or interfere with the patient's recovery. The patient should see a dentist if they're experiencing any tooth or jaw pain, if their mouth is inflamed, if they are having sensitivity or difficulty chewing, speaking, or sleeping. Addressing these concerns will also help the healthcare team plan the patient's treatment in a way that will reduce the need for strong pain medication.
Hello, my name is Vivian, and I will be one of the dentists on the team. In rural communities, healthcare professionals, like dentists, can play an important role in opioid safety. As a part of the opioid care team, we double-check all medications, review dosing for prescriptions, and educate patients on side effects of opioids. If me or one of the other dental professionals on the team has concerns of incorrect usage, we can refer patients to many different resources such as primary care or mental health therapy.
Hello, my name is Kiran and I will be one of the dentists on the opioid care team. My role is to address any dental related and oral health related issues that contribute to opioid use. I will be evaluating patients' health conditions and dental conditions and will be detecting if the pain is coming from an untreated condition such as bruxism, trauma, infection, or caries decay. I will also help guide them towards a definitive treatment to get to the bottom of treatment rather than continued opioid use. I will also be looking out for any oral signs that indicate use or misuse of opioids and continue to monitor the patients to ensure safe care, all whilst communicating with the rest of the team. Thanks.
Hi, as a fellow physician on the team, I would recommend that prior to prescribing opioids, we go through the patient's current medications to make sure it's safe for them to use and make sure that they have all the information, warnings, and instructions that they need to take them safely. I would give them information to make sure that they can both avoid an overdose and also how to treat one if they do experience it. Opioids should never be taken with alcohol, benzodiazepines, or sleeping pills. The patient should watch out for extreme sleepiness or slow breathing, and if they see any of these signs of lethargy while taking them, they should see an emergency room immediately. And lastly, the patient can also keep naloxone with them to treat an overdose if that does happen.
Hello, my name is Pranal Kandula.
I'm Aditya Bhatt.
My name is Andrew Song.
We're all students at Chicago College of Osteopathic Medicine, and this is how we would approach this case. We would take time to thoroughly educate the patient about the effects of opioids on their overall health and how those medications could potentially affect their body, particularly when taken in excess or outside of the prescribed guidelines. We would also discuss practical steps the patient could take to reduce their risk of overdosing in the future and try to minimize harm, emphasizing the importance of just recognizing early warning signs.
For instance, if the patient had symptoms like shallow or very slow breathing, or something as serious as bluish discoloration of the lips, or excessive sleepiness and difficulty staying awake, we'd stress that these are pretty serious signs and they require prompt medical attention.
And then in these kinds of situations, we would also encourage the patient to schedule an urgent appointment with their physician as soon as possible, and also coordinate with the emergency medical services to administer naloxone if needed.
Ultimately, an early intervention would allow the healthcare provider to evaluate and treat the patient quite promptly, and that would help prevent potentially life-threatening complications and long-term health consequences to the patient.
Hi, my name is Janie, and I'm one of the student doctors on the team. And I would inform my patient about the effects of opioids on the patient's health and body, and how they can take steps to not overdose in the future. And for example, if the patient was experiencing shallow breathing, blue lips, or excessive sleepiness, I would inform the patient to either make an appointment with me or another physician, and therefore the doctor would be able to help treat the patient as soon as possible in order to help avoid long-term effects.
Hello, my name is Linda and I am another physician on the opioid care team. And as a part of this team, I would work closely with pharmacists to educate patients on what their opioid medications look like and how to distinguish them from other prescriptions so that they don't mix them up. I would also make sure patients are fully informed of how addictive opioid drugs really are and discuss alternative pain management options, especially for individuals with high risk factors for opioid use disorder, so that they can make informed decisions on their care. In cases of suspected overdose, I would coordinate directly with addiction treatment centers, behavioral health providers, and social workers so that supportive services are available during and after their recovery. Finally, I would use medication-assisted treatment to prescribe FDA-approved medications for opioid use disorder. Using MAT in conjunction with mental health support will provide the best chance for our patients to make a successful recovery from any overdoses or opioid use disorders, and their progress can be closely monitored by every member of our opioid care team. Thank you.